I'm Dr. Sumit Talwar. I'm the chairman of Bariatric Surgery for Manipal Healthcare Enterprises Limited, and I'm working out of Manipal Hospital, Bangalore at the moment. I'm the consultant minimal access and bariatric surgery here. Bariatric surgery is about treating obesity. So we have to understand the obesity epidemic that has swept the whole world. In the developed countries, almost 1/3 of the population is obese, and 2/3 is obese, and almost 1/3 is morbidly obese. Morbidly obese patients are those who need bariatric surgery to lose weight urgently so as to prevent all the complications. India is not far behind. It is an estimate that about 10 to 15% of the Indian population is also obese. And about half of them would be such who would be needing bariatric surgery to reduce weight. In India, bariatric surgery has developed over the past 10 to 12 years, and currently we are doing about 15,000 odd cases a year in India. World over, the bariatric surgery is evolving for the past 20-25 years now. Initially, we were doing open bariatric surgery, that means cutting open the abdomen. Nowadays, it has shifted to laparoscopic method, which has become much safer and much comfortable for the patients, and the recovery is faster. Today, if I talk about the safety of bariatric surgery, the risk involved in bariatric surgery is equivalent to, say, doing a laparoscopic hernia operation or a laparoscopic cholecystectomy. So the expected mortality in a good center would be close to 0.1 to 0.5%, and the complication rate would be similarly low, about 3 to 5%. The biggest challenge that we face today is that we still think that being obese is the fault of the person who is obese. This is what we need to change. The mindset has to change among the patients, among the doctors, among the physicians who are caring for these patients. It is not always entirely the patient's fault that he is overweight. So that mental block has to go before we start accepting obesity as a disease which it is now considered as. The other challenge that we face, that I face, is in convincing patients that they need to lose weight, one, and the other thing is that most patients will not be able to lose a lot of weight just by dieting and exercise. So there is a certain subset of patients who will be able to lose significant amount of weight by diet and exercise. But then there will be a certain subset of patients which we know by experience that they will not be able to achieve their desired weight just by exercise and diet. Although everybody before going for bariatric surgery must have tried diet and exercise for a significant period of time before we offer bariatric surgery to them. But then they have to start preparing themselves mentally as to which road they are going to take. The third problem that I face is that most people want to delay surgery for as long as possible because it is thought of as an irreversible thing and a big thing. So what general public and the physicians who are taking care of obese patients need to be educated about is that surgery is probably not the last resort, but maybe it should come much earlier, so that we can prevent all the complications and all the problems that are associated with being overweight. And we can give them a better quality of life, we can increase their lifespan, and we can avoid all the diseases which are associated with obesity, like diabetes, like hypertension, high blood cholesterol, obstructive sleep apnea, arthritis, spine problems, urinary incontinence, and many more can be counted. At Manipal here, we have a holistic approach to the problem. We know and we believe that not every patient who is overweight is a candidate for surgery, and not every person who would ultimately be a candidate for surgery should be offered surgery right from the word go. So we have a comprehensive Manipal weight management program which involves non-surgical as well as surgical management of obesity. We have a full-fledged team of people, including dietitians, including exercise physicians and therapists, who will assess the nutritional status and modify the diet, advice on exercise. And then we filter out patients who have not benefited from the medical weight management program. They are then offered surgery on the basis of their BMI and other problems. Patients who undergo surgery are then followed up with the full team in the post-op period also, because as most people would know and understand, that bariatric surgery is not just a one-off encounter, that you do the surgery and your job is done. The follow-up is for a prolonged period of time, and the commitment from the doctor and the patient is lifelong. So the basic difference between anybody who can operate for bariatric surgery and a center which is a good center like Manipal is that we follow a holistic approach to the person rather than developing the surgical specialty alone. Well, the cost varies according to the type of operation that is done. It starts at about 3 lakhs and then goes up according to the type of surgery and the number of days the patient has to stay in the hospital. In the near future, I think the direction would be twofold. One is that the types of surgeries will evolve. We'll get newer and different types of operations that we would be evaluating and performing for weight loss. And the other significant thrust would, I believe, be in a non-surgical arena. There are a lot of exciting things happening: endoscopic sleeves, pacemakers, and I believe there may be one day when we can find a hormone or a pill that controls the hunger and maybe would allow the person to lose weight without having the side effects of the current medications that we have.
Fine, sir. Thank you.
Thank you very much.